there are few additional tests also we can do to diagnose a prediabetes. Among them, one is insulin test. Second, we can do a waist circumference. And third, we can do a lipid profile where we see the triglyceride and HDL ratio. If the triglyceride and HDL ratio is more than 1, it usually indicates an insulin resistance or pre-diabetic state, which is actually a surrogate marker, which is not a direct evidence of a prediabetes, but is an indirect or surrogate marker by checking a lipid profile and checking the triglyceride and HDL ratio. If the ratio is more than 2:1, it is indicative of an insulin resistant state. While we taken waist circumference, if the waist circumference is more, especially in Indian subcontinental standard, for male if it is more than 90 centimeter and for female if it is more than 80 centimeter, then we call it as an increased waist circumference or abdominal obesity. And abdominal obesity correlates directly with insulin resistance and prediabetes. So we can check the lipid profile, we should check the triglyceride and HDL ratio, we should check the abdominal waist circumference and should be less than 90 centimeter in case of male and less than 80 centimeter in case of female. Along with that, we can check the fasting insulin and fasting sugar, and there is a mathematical formula where we can calculate the insulin sensitivity of a person. You check the fasting sugar and check the fasting insulin, and you multiply that and divide that by a dividing factor by 405, and if this result comes less than 1, that is normal, and if it is between 1 to 2, it is abnormal, and if it is more than 2, it indicates there is an insulin resistance. So this mathematical model is known as HOMA-IR, and this HOMA-IR basically can give you an objective evidence that you are having a prediabetes long before the prediabetes actually sets in. So you have to do a fasting sugar, you have to do a fasting insulin. Along with that, you can calculate your HOMA-IR by this equation. You should check your waist circumference as well as you can check your lipid profile, triglyceride and HDL ratio. By doing all those tests, you can detect your prediabetes well in advance and you can prevent the progression of prediabetes.